Good afternoon, Miss Walker.
Hi.
My name is Heather. I just performed my hand hygiene and pulled the curtain for privacy. Today we are going to be doing a head-to-toe assessment. I'm a nurse practitioner student at South College University. Are you okay with that?
I'm good. Yeah.
Okay, great. So we have already obtained vital signs for Miss Walker. Prior to this, her blood pressure was 114/78. Her respirations were 16. Her heart rate is 72 with an SpO2 of 100% on room air. She is 5'3" and 115 pounds. We also completed the Snellen eye chart, and she was 20/20 with her corrective lenses on. So next we are going to ask a couple questions.
Okay.
I just want to check your orientation. So can you tell me your name?
It's Brooke Walker.
And what's your birthday?
It's 9/11 of 95.
Okay. And what year is it?
It's 2024.
And where are we right now?
We're at Richmond Memorial Hospital.
And who's the president?
President Biden.
Okay, so she is alert and oriented ×4, and she can hear and speak because she has responded to me, as I mentioned earlier. We will start with examining your scalp and your hair and your head and face and neck.
Okay.
All right, so I'm just gonna look over your scalp. You tell me if you have any pain or tenderness. So her scalp seems to be smooth. Her hair is evenly distributed. I don't see any scaliness, any lesions. I don't feel any lumps or deformities. Are you having any pain or tenderness?
No, I feel good.
Okay, so everything is good there. We'll get you to just sit back up. That looks great. Her skin color is appropriate for her ethnicity. She seems to be very well nourished. And are you having any problems with any of that?
I don't have any complaints.
All right, great. So we are going to check your frontal and maxillary sinuses. Okay. So you're just going to feel me palpate, and you let me know if you feel if you have any pain.
Okay.
Any pain?
No pain.
Okay. All right. All good. All right. And we're going to check your temporal pulses while we're here.
Okay.
And there. So no pain or tenderness across the frontal or maxillary sinuses. Her temporal pulses are good and strong. We are going to do your eyes. I think it died, but we're gonna pretend.
Oh, there it goes.
Oh, there you go. Oh, yeah. Okay. So I'm just gonna shine a little light. So her pupils are reactive and brisk and round, size 4. They respond to light well. She does not have any redness or conjunctiva drainage. And we will check your nose. I'll just take a peek at your nares. So her nares are good. I don't see any deformities or deviations. They are clear of any drainage or that. And so I'm gonna get you to close your eyes. We're gonna do a smell test. All right. Tell me what you're smelling.
Coffee.
All right, good job. Okay, so we're also gonna check your passage and see how you're doing. So if I can just get you to hold one side and, all right, good job. And let's do the other side. All right, so her passages are clear, and I'm gonna palpate your neck. Her face is symmetrical, her neck is symmetrical, it's intact, everything's good. I'm just gonna palpate around. Any pain or tenderness?
No pain.
All right, I'm also gonna be checking for your lymph nodes while I'm doing this too. So I don't feel any lumps or abnormalities. All of her lymph nodes are good. And her ears are symmetrical, they're intact. I don't see any exudate drainage on the outers. We will look with the otoscope to see what we see in there. And we've already put our little thing on there because it's been a little difficult with us today. So we're just gonna take a peek in here. Any problems with your ears?
No.
Walker?
They've been good.
All right, great. So her tympanic membrane is shiny and gray. I don't see any drainage. Again, it's shiny and gray, no exudate or drainage, no buildup. Alright. We're gonna move on to your mouth. I'm gonna put some gloves on for this one. So we're gonna use a tongue blade. Now, Ms. Walker, you say you do not have any tonsils, is that correct? You have had a tonsillectomy? Okay, so there will be no tonsils to grade in this, but we will check your uvula and make sure that it is in midline and your teeth and gums. Okay, so if you just stick your tongue out. Alright, all her teeth look great. Gums look good. I don't see any cavities. Gums are pink and moist. Stick your tongue out one more time and say ah. So her uvula is in midline and it is intact. Her lips are good and moist. Her buccal mucosa is moist and pink. No cracking or dryness noted. I'm going to do a sensation test. We're going to have you to close your eyes and we're going to, you tell me if you feel soft or sharp. Okay, I'm going to touch your forehead, your cheeks, and your chin.
Okay.
All right.
Sharp. Soft. Sharp. Soft.
All right. So her sensation is intact on her face. Next, we will check her cranial nerves 7 and 12. We're going to do a couple silly faces. So I'm just going to get you first to clench your jaw. All right, clench your teeth really good. And smile real big. Puff your cheeks. Stick your tongue out, side to side. Squint your eyes. Raise your eyebrows. All right, so all of her cranial nerves 7 and 12 are intact. We will do the 6 cardinal of a gaze and check cranial nerves 3, 4, and 6. So, all right, so I want you to look straight at me at my pen, and then I want you to follow just with your eyes, okay?
Okay.
All right, so she done well with that. Her cranial nerves 3, 4, and 6 are all intact. Next, we will do the check her confrontation and cranial nerve 2. So what I'm gonna have you to do is you're gonna cover your eye, and when you see my fingers wiggling, I want you to let me know, and let me know when you don't see them. Okay? So, all right.
I see them. They're gone.
Okay.
I see them. They're gone.
Okay. Let's do the other eye.
I see them. They're gone. I see them. They're gone.
Okay. So she, cranial nerve 2 is intact. Next, we are going to move on and we will do our, check your carotid pulses. That's what we're going to do. All right, so I'm just going to do one at a time.
Okay.
All right, and I'm also going to check for any JVD extension. Her carotid pulses were good and strong. So if you just kind of turn your head, no JVD extension is noted. Again, on this side, up, and no JVD extension is noted. Her shoulders are intact and strong. No lymph nodes. Palpate down here. Any pain or tenderness?
No pain.
Okay. All right, so can you push up against me? All right, good job. All right, so I'm gonna check your brachial and radial pulses. Her radial pulses are good and strong. Her nail beds are Her nail beds are good and pink and no clubbing noted. She's got great refill, a cap refill. Her skin is warm and dry, again, as she is appropriate for her ethnicity. No wounds or lesions or abrasions are noted. I'm gonna take a listen. We're gonna listen to your heart and lungs on the front side, and then we'll move to the back side. Is that okay?
Sounds good.
Alright. So first I'm gonna listen to your lungs. Just breathe one moment. Alright, the lung sounds are clear and good. Your chest is symmetrical. I don't see any deformities, any pain, or having any chest pain or anything like that. Alright, so next we're gonna listen to your heart. Alright, so S1 and S2 were present. No presence of S3 or S4, any gallops, mimic, clicks, or murmurs. Lung sounds were good. And I'm gonna do a test where we're gonna check for any tactile firmness. What I'm gonna do is I'm gonna put my hands on your back, and as I'm going down, I want you to say 99, okay?
99.
Okay.
99.
Okay.
99.
Okay. No tactile primitus noticed. And we're gonna check for some egophony. Again, whenever I check, I just want you to say E, okay? Okay. All right.
E. E.
Again.
E.
Again.
E.
Again.
E. E.
All right. So no egophony noted. I'm gonna listen to your lung sounds while we're back here as well, okay?
Okay.
All lung fields are clear. Her spine is straight. I don't see any curvature. So we're gonna move on, and while we're doing that, we've done your lungs, we've done your heart, we've done your face, neck, head, arms, skin. Let's do some range of motions. How's that sound? Okay, so we're gonna extend your arms out. Any pain, any discomfort? Lift your arms up.
Okay.
Pain or discomfort? Pain or discomfort? Pain or discomfort? Okay, I'm gonna do your wrist. And then we'll do the Tillings test.
Discomfort.
Okay. All right, so I'm gonna see here. All right. Let's move to the back. I'm gonna check for any CBA tenderness.
Okay.
And I'm also gonna percuss when I'm back here too after this. Okay. Any tenderness?
No tenderness.
Okay. Any pain or tenderness?
No.
All right. Any pain or tenderness?
Good.
Okay. All right, we're gonna get you to lay back. We're gonna listen to your belly. I'm gonna do a couple things, okay? We're gonna keep you clothed just because this is for instructional purposes only. It's for a class, and we are not gonna expose anything, okay?
Okay.
So first, I'm just gonna palpate lightly. I'm gonna percuss first. I'm sorry. You tell me if you have any pain or tenderness.
Okay.
pain or tenderness?
No pain.
Okay. We're gonna listen. We're gonna listen to all 4 quadrants. So vowel sounds are active, no hyper or hypoactive vowel sounds, they are normal. I'm gonna do some light palpation and then we'll do some deeper palpation, okay? And we're gonna be checking for any splenomegaly, liver distension, and you just let me know if anything hurts. Okay. So light, any pain, discomfort?
No pain.
Alright. Just maybe a little deeper. Okay. Any pain or tenderness?
Pain.
Okay. So no liver distension, splenomegaly, no complaints of any belly pain, no bladder distension noted. Let's do some frictions. Do we have any frictions or rubs on the percussion? No. No frictions or rubs on the percussion. Yep, no frictions or rubs. Okay, so now we are going to check the arbitrator signs, and this is gonna check for appendicitis. Okay, so get your leg on your left side. I'll put your leg back. You let me know if you have any tenderness.
Okay. No tenderness.
Okay. And then if you can get your leg right back on your side again, and we're gonna do one more test and do one more sign, and this is called the psoas. And we're gonna take and bend your knee up to your belly. Any pain or tenderness?
No pain.
Okay. All right. So while you're here, we're gonna go ahead and just check your hip reflex and check range of motion. So we're just gonna get you to bend your knee. Okay. Put your leg out. Okay. Any pain, tenderness?
No pain.
No. Same thing with the next one. Pain or tenderness?
No pain.
Okay. Great. All right. We'll get you to sit up for me. We're gonna check your range of motion with your legs and check your reflexes.
Okay.
So I don't have a reflex hammer, so we're just gonna demonstrate what we would do. For the brachial, we would find the tendon and hit it with the hammer and get a reflex. That's the bicep. The tricep, same thing. Back here, find the tendon, hit it. The brachial radialis, it would be right in here. The patellar would be on the knee, right in on the ligament, and then the Achilles is gonna be in the back. We've checked your brachial and radial pulses. We're not doing femoral because we're not undressing, but we would check those bilaterally in the groin. Your popliteal pulses are good. Your pedal pulses are good. All right. And can you do some range of motion with your ankle? Can you roll your ankles? All right. Good job. And stand and you do some light squats. All right, and let your leg out, bring your leg up. Any pain, any tenderness? Same thing. Let your leg up. All right, good job. And I'm gonna get you to do a few squats, just soft squats. There you go. Any pain or tenderness?
No pain.
All right, and can you bend over and touch your toes? And we're gonna check your spine. Any tenderness?
No tenderness.
Okay, you can stand up. All right, and well, you can have a seat back, and we will do start our neurological part. I'm gonna have you to look straight at my nose, and with your finger, I want you to touch your nose and touch my finger. Okay. All right, good job. And we're gonna do some fast hand movements. Let's see. Good. All right, good. Can you take your heel and do up to your shin on your opposite leg? All right, that's great. And I'm gonna have you to take a few steps that way and let's walk with your, see how your gait is?
Okay.
Your gait is steady. Okay, can you walk back on your tippy toes? Coordination is great and steady. What about on your heels? All right. So that is all good. Our last thing we're gonna do is the Romberg's test. So I'm gonna have you to keep your feet together, close your eyes, and just stand still for me and see how you do. All right, and you have passed the Romberg's test, my friend.
Okay.
Everything's checked out okay. You have a normal health assessment. And thank you for your time and
Alright.
participation.
Thank you.